Lots of women and men of a certain age are looking to freshen up their look, and there are so many ways to do that. We want to welcome our plastic surgeon, Dr. Elie Levine, and his dermatologist wife, Dr. Jody Levine. They practice together on Manhattan's Upper East Side. Hey guys, good to see you again.
Good to see you too.
Hello.
All right, so I want to talk about this because volume, is so important. I don't think people realize how important volume in the face is. Explain that, Jody.
It's true. Most of us, women and men, lose volume over time. Anyone over 35, 40, you're losing muscle, you're losing fat, you're losing bone with time, and just volumizing the face really makes you look young.
And you do that with things like fillers and fat transfers, which is something you both do, right?
Exactly.
So explain that to me, how that works.
So patients will sometimes come to me, sometimes they'll come to Jody, and it really depends on the degree and the severity of their facial volume loss. And if it's a small amount, then fillers are really great, and there are a lot of different ones out there. But if someone needs a significant volume increase, then fat transfer is the best way to do it. And it's just a matter of taking fat very delicately from somewhere else in the body and putting it in the face. And you can use it on the face, you can use it on other body parts too as well that you may want to augment or volumize.
We have some amazing before and afters, which I really think show the difference. And people don't really realize, because it happens so gradually over time, how that volume is lost. But when it's replaced, it's very dramatic.
So to get a very natural looking facelift sometimes, you need not only to remove the excess jowls and the neck laxity and everything else, but to volumize the face again. And so it's one of those things where if you want to get a natural look and not just a better look, that really is instrumental.
Yeah, because I don't think people realize they'll get a facelift and they'll pull the skin tight, but they don't have the volume there. And it almost looks like the tight skin on a skeleton. It's a dead giveaway, right?
And some of those facelifts that are done without volume, those are the ones that have that pulled back look that nobody wants.
Yeah, I agree. I don't think they look good at all. And now, besides a full face, though, you also do a mid facelift as well, right?
Correct.
Explain that.
So I would say that patients more in the 40 to 50 range, where they may not have a significant amount of jowling or neck laxity, just has their mid faces drop down a little bit. And sometimes you can fill it, you use fillers, but sometimes they need a small lift, and it's a smaller incision, shorter recovery, and a quicker response, and it's also just a nice subtle way to improve the face.
Right, and we have the before and afters of that as well, and there you go, a younger type woman who has that need to just pull back. I think it's great.
Exactly.
Yeah, the neck also, we talked about that. Talk about how that's so important and how the chin plays a role as well.
Right. So some people come in and they're concerned about their neck laxity, and oftentimes it's genetic, where they'll say, my mom has the same anatomy, or my dad, and they saw it coming for over a number of years, and they finally come in to address it. And what I notice on a lot of patients is they also have a small chin. So augmenting the chin, putting in a very small chin implant that can be put in using the other incisions that we're making anyways, can augment and improve the contour after surgery.
Yeah, and it's not dramatic. It's so subtle you wouldn't even notice it. All you know is that you just look better.
Exactly.
Now, I want to get to the icing on the cake, because you do all this work, right? You fill, you put the volume in, but there's nothing like resurfacing the skin and making it look great. And that's where you come in, Jody, really with that expertise. What does that do for patients? How does that work?
Wrinkles, fine lines and wrinkles is everybody's concern. We use all these creams to try to get rid of them, but creams can only help so much. Laser procedures for resurfacing are fabulous, and they really make your skin smooth.
Yeah, it makes it smooth and it makes it glow, right? So all of a sudden you went for a procedure, it's tight, it's full, and the skin glows, which is, of course, the best way to go.
It's what we call the trifecta of facial aesthetics. We're lifting with a facelift, we're volumizing, and then we're resurfacing.
Yeah, well, it's working for sure, guys. Thanks so much for coming in. Really appreciate it.
Thanks for having us.
Thank you.